period is always a confusion. So some say that a 28-day cycle is normal. Some say a little more or less than that is normal. So I'm going to clear this confusion now. But before that, it's important to understand that your periods and your hormones keep fluctuating as you age. So when you hit puberty or when you hit menarche, that's when your periods start. Your cycles may be as long as 40 to 42 days also for the first 2 years. After that, the cycle length keeps on changing till the time you turn, say, around 25 to 26. Till then, your cycle length will vary. Beyond that, also, it will vary because pregnancy happens, breastfeeding happens. After that, menopause happens. So, throughout all of these processes, at every stage of life, your hormones will vary. Thus, your normal period, the definition of a normal period will vary. So a normal length for an adult is 21 to 35 days. Anything less than that, anything more than that, it's not normal. So sometimes we say, yeah, I get my period every month, but it's sometimes 2 days late, it's sometimes 2 days early. So always we have this confusion, right? Is that okay? Is that not okay? Is exactly a 28-day cycle normal? Exactly a 30-day cycle normal? So normal cycle length is 21 to 35 days. Next, the duration. So the normal duration of your period, your menstrual phase is 3 to 7 days. Now, a lot of females complain that after the age of 26 or after the age of 27, their duration reduces to 2 days, sometimes even 1 day. In this case, it is important to get your hormones tested. It could be an estrogen deficiency, it could be high prolactin, it could be a sluggish thyroid, or it could be something else, nothing related to your uterus, because there are other organs also involved in maintaining a healthy period. So anything that is less than 3 days, anything that is more than 7 days is not normal. Third thing is clots. Now, small quarter-sized or pea-sized clots during your periods are normal. Anything bigger than that is not normal, and anything the volume of the blood also makes a lot of difference. So the heaviest flow will be during the first 2 days of your cycle, and after that, from the third day onwards, your cycle flow comes down. And on an average, using 2 to 3 sanitary napkins for the first 2 days is normal. If you use any more sanitary napkins beyond three, then that's a very heavy flow. If you have just spotting during your periods, then that is not normal. The color is super important. When your flow is heavy, bright red, later on it comes down to sort of brick red. It becomes a little dark towards the end. Mid-cycle spotting is also something that a lot of females complain about, and there's always a question mark whether it's normal or not normal. Now, mid-cycle spotting is a part of ovulation. Ovulation, if you see this circle, the blue part of that circle, that usually ovulation occurs usually on day 14, that is a very important phase of your periods. What are the signs of ovulation? Having a sticky egg white consistency discharge is a part of ovulation. Your basal body temperature slightly increasing is a part of ovulation. And having spotting that does not last more than 4 to 5 days, and you don't need a sanitary napkin for that, it is that less. Okay, and that is what is ovulation, and that is a marker of having a healthy period. If you do not have ovulation for any of your cycle, it is called an ovulatory cycle, which means absence of ovulation. And in between, if you have 3 or 4 such cycles in a year, that is normal, but anything beyond that is not normal. Why am I emphasizing so much on this? Simple reason. A lot of girls use OCPs or oral contraceptive pills if they have PCOS. These are prescribed by doctors. They use this pill to so that they get their periods on time. They take it for 21 days. continuously and then they get their period on the 23rd or the 24th day. This pill is going to stop your ovulation, and what you will get is only withdrawal bleeding because your body's hormones will stop functioning and only the pill's hormones will act, which is very, very unhealthy and comes with 100 other side effects. Massive mood swings, acne, hair fall, your bone health being affected. And that is the reason why it is not recommended that you use these oral contraceptive pills. It stops your ovulation, and any cycle without ovulation is not a menstrual cycle. It is only withdrawal